Hello, everybody. Welcome. Thank you so much for coming. I feel like of all the many events that are happening this week and simultaneously, this is the one I was most excited about. And the reason is, here's an embarrassing story. So when I was in high school, I won the National Debating Championship. And the only thing more embarrassing about being one of those really lame debater kids in high school was the fact that it took me many, many years past high school to understand that the key ingredient for change is not winning the argument. Actually, it's a lot more complicated than that. There are several more steps, and that's the bad news. But the good news is that those steps are actually codifiable, replicable, have been used by many of the people in this room to drive the uptake of new standards, programs, budget lines in public sector systems. And we're going to get to dive into the nitty-gritty operational detail of what those are today and have an exchange about what that looks like. So I am beyond thrilled that we have a long list of incredible collaborators with us in the room today. There is a movement builder. There is somebody who's gotten the government to adopt a standard at every single table in this room. And we are excited to have all this expertise. I want everybody listed on this slide to stand up. We have Maureen Wauda, who is a CHW from Kenya and a leader in the National Association there. We have Bernardo Xavier, who is a leader in the CHW Association in Brazil. We have Ignatius Belongo and Lonnie Hackett, who have been working with both the Minister of Health and Education across the continent. So wave, guys, getting new standards taken up nationwide. We have Flavia Pellegrino, who is leading the democracy movement in Brazil. And we have many additional members of Community Health Impact Coalition, some of whom have volunteered to lead tables, and some of whom are just sneaky and in the room and willing to share their expertise. So those leading tables are Emily Chambert from Living Goods, Ash from Luala, Ash Rogers from Luala, co-CEO, Julius Mbea from Luala, arriving right on time, Solène Scotney from Financing Alliance for Health, and we have Tabika, and we have Fran, and we have Chad, and we have so many people from across the MEDIC team, from across the Community Health Impact Coalition team, who are also here in the room and ready to share, Jeff, their experience. And we're most excited to trade notes with all of you, because I feel like too often when it comes to movement building and trying to drive the uptake of new standards or budget lines within the public system, which is often the biggest provider of health, education, many public sector services, we're working so hard, and we don't get a chance to sort of turn our head to the left, turn our head to the right, and see what we might use from other movements, researchers, advocates in other sectors, and how we might apply those tactics to our own struggles. And we need to do this work for two reasons. One, because right now, we are often, as we were talking about yesterday, we respond to social failures often by giving a fish, which we need to, right? Because when people are suffering, they're hungry, you need to give a fish. We sometimes talk about teaching people to fish, which is also important. But unless we want to be doing that for generations to come, we also fundamentally have to reform the fishing industry and ask why it is that people are hungry in the first place. And that is the work of field catalysts or multi-stakeholder initiatives, movements, and it's not common enough yet. That's reason one. Reason two is that even when that work does take place, too often those initiatives fail. The vast majority of multi-stakeholder initiatives right now don't achieve their intended aims. I think we can up that percentage considerably, and it starts in this room. So we're going to start this team here on this stage by sharing a little bit about the professional community health worker movement. Then we're going to hear a little bit about health and education and democracy. don't worry, we're all going to talk collectively for less than 15 minutes so that we can get to the real point of today, which is this table exchange around tactics and building on the case studies and suggestions that we're sharing with you for your reactions, refinements, and additions. When it comes to community health workers, that's these guys. They're all over the world. They're providing care to their neighbors, and yet most are still unsalaried. They're out of stock 1 out of 3 days in the week, and that's a problem because it means that not only are they being exploited from a labor perspective, people are not getting health care, right? They're not getting the best care available because the people who are trying to give it to them are not adequately supported. And so this collective that I just announced in this room, when we came together, a handful of countries 10, 15 years ago accredited and salaried CHWs as part of their national health system. Today, it's over 50 countries around the world, including Kenya and Brazil. So we can give a little round of applause for that considerable shift in the Overton window of what governments think is possible, what CHWs feel is achievable, and is financeable. And of course, there's implementation challenges every day, but we're a long way from where we started, and we're looking to bring on the next 50 countries to really cement this norm. The way that we have done this, and this is a framework that we made up really recently, so we're going to ask for your suggestions, is through an approach called Drive. And this is something I've been thinking about, and we're going to walk you through together. How do you drive the uptake of a standard within a public system? Step 1 is you have to define the gap and the bar. This sounds really obvious, but often when you come up with a concept like localization, we need more of that, it quickly becomes very distorted or co-opted by others. What do we really mean by that? So unless you have it really nailed down and you say, here's where we are, CHWs are unsalaried, they're unsupervised, they're unequipped, and here's where we need to be, salaried, skilled, supervised, supplied, you're not going to be able to drive the uptake of what you want to see, or it might get watered down along the way. But how do you do that? The second step is R.
You rally the coalition, like you have to bring up everyone to the table and make sure that everyone understands the defined thing and to bring out the solutions, construct everyone the solutions, and press the responsible persons to make it happen. You know.
Do you have a story from Brazil you want to share about how that happened?
Yeah, so Brazil, we seceded. We have seceded in Brazil, like 500,000 professional community health workers are being paid at least a double minimum wage. So, and now we are helping, we're making part of a coalition to help here in the UK, the NHS to make the pilot. They are building in to make a policy. Like we have the Fiocruz institution in Brazil, like with the researchers. We have the NHS, the government. We have the Brazil SUS. I am a part of that, like the collaboration in this last 2 years exchange. And we have another supporters, you know, the community health workers here in the UK, in London and Cornwall.
Yeah, it's an awesome collaboration if you haven't heard about it. I think it's, Bernardo's an expert both in national coalition building to improve care, but then also transnational coalition building so that models from one place can be taken up in the other place. And I remember talking to some of those CHWs. They were going to go interview for this job. They thought it sounded really cool, and they were Googling to learn more about it. And they were like, why are all the results from Brazil and Kenya? And then they were like, oh, because we're the first ones in the UK. They didn't realize. So I think this can be really powerful. But once you've identified what those conditions that are holding the problem in place, you've brought together some of the group that can change those conditions, you have to identify the path. And one of the things we've been successful at as a pro-CHW movement is by actually mapping out 100 countries. When are the windows that health policy is being debated? Because if someone decides their budget or they decide their 10-year health plan 2 weeks ago, and then you go and Bernardo's like, here's a really compelling pitch of how the NHS should blah, 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 it doesn't matter. It's already been decided. So actually identifying those windows, tracking them, and mobilizing towards them has been a really important part of our story. Once you have the windows, you gotta, what's the next step?
Okay, the next step is when I voice my demand. Back in Kenya, we have the associations. As for me, I'm standing here as one of the delegates in the National Association, which is ACHVOC, where we used to demand for our voices to be heard. Like, for instance, I'm here. We can't sit on a table discussing a community health worker, and that community health worker is not present in the house. We should be involved. We should be invited to these events so that our voices can be heard globally. For Kenya, we normally have quarterly meetings. Like the other one, we had it on a Monday that I was here. So we had virtual meetings where we discuss the 47 counties. We discuss our issues that affect each and every county. Thereafter, the executives sit down and call for action for the decision makers on ways to see how community health workers can get better payment. For we saw in a slide where majority of CHWs are not being paid, and most of them are women. A woman like me. My family needs me. For first, I need to start, a health should start with me. If I'm healthy, my household will be healthy. If I'm healthy, my community will be healthy. We need a healthy community. And also, if you don't have the commodities, the supply to give to our community, the health system will not be working. So that's why we need the global standard. And that's why we are here as community health workers, for our voices to be heard. Thank you so much.
Right on. And I think, Maureen is a powerful speaker and has been speaking at various events throughout the week. But I think what makes that voice more powerful is what she just shared. Maureen is not speaking for Maureen. Maureen is channeling the voice of community health workers across the 47 counties of Kenya who've come together to share what they need to make the health system work better and to achieve that. So that voicing of demand, that surround sound, and that credibility and authority of having a unified voice is really compelling. And the last piece is obviously to engineer and track adoption. That map where we track policies across 100 countries, it's not just our strategic plan. It's not just helping us determine where should we talk to the Ministry of Health next, where should we activate the next professional association next. It's also a scoreboard. It shows you progress over time and how the map has been changing. And it's a place where we collect stories, like, for instance, in Liberia, who changed from unpaid volunteers to salaried, skilled, supervised, supplied pro-CHWs, and saw, post that change, a cutting in half of the malaria prevalence in just 5 years, after it having been stable for the previous 15. And so that's where we collect, monitor, share the stories of this movement and encourage others to join in. So that's a little bit about how we've thought of this DRIVE, D-R-I-V-E framework. But I want to invite Ignatius and Lonnie and Flavia now to come up to the stage and share a little bit about how they've thought about tactics within their work. And then we're going to go to a shared discussion about how you've thought about tactics in yours, and hopefully emerge from this session with something we might write together. What is the collective wisdom of this Skoll community about how you drive adoption of standards within public systems? What tactics work best? What tactics might we add? Which don't work in some contexts but work in others? That's the discussion we're going to get to really shortly after we hear from Lonnie and Flavia and Ignatius. Come to the stage.
Hi, everyone. So my name is Lonnie Hackett. Ignatius and I are the two co-founders of Healthy Learners. So we exist to address the missing middle in healthcare. Kids between the age of 5 and 15 have the fewest touch points with the healthcare system and often fall through the cracks of the healthcare system. And yet those same children are in school. And so our idea was, how do we connect schools with the healthcare system to bring that access point to where children already are? And I guess we start by saying I agree with everything that Madeline had just outlined. And it's funny, as we were preparing for this session and kind of reflecting, when we started, we did not think we were building a movement. That's not how I would have described, who we were or what we were doing. And yet the lessons we've learned along the way, have really demonstrated just how important that was. When we started, it was really, the question was, how do we get these two ministries, health and education, to work together, from policy at the national level to implementation at the district level to schools and clinics really partnering in a real genuine way. And something we kind of stumbled upon early was, well, to do that, we really need to go deep and we need to go wide. Deep, at this point, we're on our 5th or 6th Minister of Health and Education. We realized we couldn't just rely on a small number of key champions. We really needed to have support throughout those ministries. From the minister, yes, you can run really fast with a key champion, but from directors, from coordinators, from officers at the national down to the district level to really have deep level of support. But we also learned that that alone wasn't enough. We really had to go wide. If we were just in one department within a ministry, we were seen as a project. And we really wanted to become a fabric of those ministries as well. So we asked ourselves, where does school health sit across every department, from not just community health or school health in the Ministry of Education, but from human resources to monitoring and evaluation to health surveillance and clinical care, and making sure it was embedded within those guidelines across the ministries as well. But even that still wasn't enough. And I think something we learned a few years ago was that, WIDE had to go beyond just the ministries we work with, but broader across the political economy and civil society. And so internally, it was investing in a government engagement team and an advocates team and a policy team. And I think what really led to a key inflection point is when we began engaging beyond just our direct partners. So we worked to build civil society coalitions within Zambia of all partners that were invested in health interventions in schools to some capacity. It was building media alliances, of having different media houses that would promote the work that was happening. It was engaging Parliament and the National Assembly. It was engaging traditional leaders across the country. And it felt like when we did have that coalition of really broad support, now all championing this work, and not as healthy learners. I'd say my in-laws who are Zambian get really upset because they'll see this work every week on TV and never hear healthy learners. And they'll call me after and say, can you believe it that you were on the news? The program was on the news, the government's taking all the credit. And I'm like, that's exactly what we want. It's not about us. We actually work really hard for that to be the case. And I think two things happened. We built such broad support, and it wasn't about us as an organization. It was about what we were trying to accomplish collectively together. And I think when that came together, we've seen the program now scale to 1.4 million children across the country as a truly government program, from policy to personnel to systems to financing.
Yeah, Lonnie has said much of the things, yeah. I know the movement which is actually being talked about is not just a straight line. I think there's a lot of things that happen on the way, a lot of learning. Lonnie, I think from the very beginning, we knew to say, we cannot actually do this by ourselves, but we knew that the government was the right people to be able to drive this movement. And from the very beginning, I think we actually brought all stakeholders on board. As Rona has put it, to say, we went deeper into the department, really working with the minister, the permanent secretary, the directors, and the officers, because we knew at some point ministers get changed, permanent secretary gets changed. So you have to bring the entire community, the entire ministry, to buy in so that the sustainability is actually maintained. When we deal with political aspect, we also look into all prayers in the political circles. For instance, we formulated a caucus for members on school health, which actually comprises of ruling party and opposition leaders, to ensure to it that even when the life span of a political party goes off the government, the incoming prayers still have buy-in. Traditional leaders, chiefs, Those are the people that actually comes in. The last thing, I think we also brought in media coalition, because we need also to have information to like spread to people to actually know what is happening, to actually understand the program, with the focus on the program, or on the problem, and with local innovation that is coming from the people that are actually feeling the pain, that are going through the troubles that are going through, and with the concept of keeping it simple, cheap, and effective.
Hi, good morning, everyone. It is a pleasure to be here with you. I'm Flávia Pellegrino, and I run Pacto pela Democracia, which means Pact for Democracy, and we are a broad and cross-ideological coalition in Brazil, a civil society coalition to counter authoritarian threats, defend the rule of law, and revitalize the democratic environment in the country. And Pacto comprises over 200 civil society organizations in Brazil, working with different agendas. These organizations have completely different strategies of actions and also very different political identities. So, like, the DRIVE framework resonates a lot with what we do. But one thing, I mean, what I would like to highlight from like this pro-democracy work as a coalition is how, because of the diversity of organizations that are part of this coalition, one of the main things is how can we, like, strategies that for us to build the collective intelligence for these organizations, these people to work together. Because at Pacto, and this is one of our, like, since the very beginning, one of the main things we decided is that we do not work with consensus ever. So we have to, like, to be mindful of these organizations' perspectives, limits, possibilities, and we have a secretariat that facilitates, like, 24/7 the work that these organizations do, like the work that we do collectively, so we can manage, like, to find common ground, build strategies together, and then we build, I would say, coalitions within the coalition, so we can do the advocacy efforts that we have to. We are focusing on, of course, the infrastructure of democracy in Brazil. So one of the main thing is, how can we, like, not only build this collective strategy, intelligence, but also joint strategies respecting their, like, on the one hand, respecting what they can do, and also valuing, like, this expertise these different organizations have. And in this kind of work, one of the main tactics is also to anticipate threats to democracy. So, like, a huge part of the work that we do is, like, mapping and understanding what is at stake and what can be at stake in the next, I don't know, 6 months, 1 year. So, for example, now we've been, like, since it's been a year already, we are already working to defend the integrity of elections in Brazil next October. And it's also about, on democracy, it's always about, of course, being responding to threats, but especially, like, being ahead of it and anticipating all the threats that we can. So we managed to build this work together and also find a way, and to conclude, is just, this is kind of like we crafted, like, it's not, there's no recipe, like, to do this kind of work, because of course the political landscapes change from one country to the other, but we are trying, like, with this kind of handbooks, for example, to share, like our lessons, our methodologies, and things that in Brazil were successful somehow, and we're trying to share it with like civil society worldwide, so we can try to, like, also inspire people who are trying to defend democracy in their countries. So briefly.
Amazing. Thank you, guys. So that is right on. As you can tell, you could probably write a whole book chapter on the D, the R, the I, the V, the E, right? As we're identifying windows, Are we just talking about one ministry, or are we talking about 7 ministries? As we're rallying the coalition, that's a really easy sentence to say. What are the 27 things you need to do to build trust, to keep people engaged, to make collaboration easy and impactful? And that's the book that we're going to write together right now. One of the things that we want to try and do in this session is list out as many different tactics, intel, approaches, methodologies, like Flavia was saying, in specific detail in those categories or additional categories. And hopefully, we might write something at the end of this, sharing our collective knowledge. But the 3 prompt questions that we're going to look at together over the next 25 minutes or so at our tables is basically, 1, is any of this resonating? Where have similar tactics worked in your context? Which ones feel like they're the most important, the load-bearing beams, the most replicable? 2, which ones sound like, heck no, we tried that and it didn't work, and here's why? And what is that nuance that comes out there? And then 3, what did you do differently than CHIC or Healthy Learners or Pacto that hasn't yet been mentioned, but feels like was a very important strategic decision or tactic that you used in your own work to drive that uptake of a particular standard or budget line or approach within the public sector? So I think we have, if you are 1 or 2 people at your table, I'm going to invite you to join one of the more crowded tables. I'm looking at you guys. I'm looking at you guys. And so we're going to just delete this table and delete this table. Please move right now. We're doing it. I'm going to invite you guys to join. And then for all the tables that have a number of people, can the table facilitator put up their hand so you identify yourself? Okay. Solène, yes. Flavia, perfect. So we're going to break out right now. We're going to come back in 25 minutes. And then we're going to hear from each table a rapid-fire response to these 3 questions. What resonates? What doesn't? What would you add? All right, friends. We are going to do a little group harvest. We got to do it. We got to do the clap. Clap if you can hear me. Why are you looking at me like you've never done this before? These guys have never done the clapping before. Julius, we know you're very smart, but we got to stop. Solène, again. Kevin has written a book, if you want to hear more from him. No, the hardest thing is to stop. The reason we spent actually 40 minutes in discussion is because this is the best part. We do, though, want to see if we can get a little cross-pollination between the groups, just like Bernardo was sharing, between the UK and Brazil. We want between table 1 and table 3 and table 5. So we thought we could just do a quick harvest of some of the key insights that everybody discussed. And the way we can do that is we'll just go 1 question at a time. So we'll hear very, very briefly from the lead, scribe, leader, table lead from each of the tables, 1 or 2 things that you all discussed in answer to each question. So just to refresh, we shared this framework, defined the standard, pro-CHW, salaried, skilled, supervised, supplied. Rallied the coalition to solve those conditions holding the problem in place. For us, that was guidelines, funding, policy. How do we change them? Identify the path. What are the relevant windows that there's actually a possibility for change? Let's try and anticipate them. Flavia was talking about that. And plan for them. Voice that collective demand. We learned as a pro-CHW movement from the disability movement, HIV movement, nothing about us without us. That has been a key driver of our success. And then engineer and track adoption. So for us, we have this big world map, the pro-CHW dashboard. Where do we have policy? Where do we not have it yet? And where are we going next? So question 1, we'd love to hear from each table 1 or 2 things that worked, where you were like, yes, our standard is Loctite down, or you're like, oh yeah, you know, this really resonates with how we've engaged government champions, or this really resonates in terms of how we've created trust within a coalition. I'm just gonna call on each table host to share one or two things that came up where folks were like, oh yeah, that was similar. And if the answer is nothing, that's also instructive. So no stress. If you're looking at your notes and you're like, there was nothing, it was all new, we'll get to that question next. So I'm gonna come to Flavia first. What at your table resonated from the stories that we all shared collectively?
Yeah, here, like, everything I would say, like, and you can help me out, of course. Like everything, all this, the framework resonated a lot. In fact, we had a great discussion, but we didn't necessarily like respond to the questions. But it was mostly about like we were talking about like what worked in our experiences, what didn't, and like some of the main like takeaways about that. And one of them like we talked a lot about rallying the coalition. Of course, maybe I'm a little biased. So like
what worked?
And one of the things was like action is oxygen, like to do it, like to keep the coalition. We were talking about how to keep the coalition alive and how people can engage. So this came up with a really important aspect of it. Trust, like being, of course, the core of this work among members and also among stakeholders.
How do you build it? Any suggestions? Did you guys talk about that?
Yeah, over time, of course. Yeah, and yeah.
Okay.
And
if
being like the right and time and timing as well, because yeah, it was, and then I'll keep the other one for the next question then.
Right on. Okay. Awesome. Ash, what resonated? What were the key things that felt like were resonating at your table?
And I think what was exciting is that we heard examples across disability inclusion. We have someone actually working in government, you know, from the perspective of kind of being the recipient of some of the driving. Examples from philanthropy of how this has worked. And I think that the bright spots that kind of came out was around an idea around easing adoption. And so which I think is this tracks with this kind of engineer and track adoption, but we have notes on some of the language. And so, but what worked was kind of when solutions were matched with financing and resources and support and evidence. And then another point that came up of what worked is the kind of seeing this piece as how did you say that it's not pillars instead of phases, so that it doesn't go in a chronological order. You can kind of start at any point, but then you also may need to circle back to different pillars over time.
Right on. So Len, what about you guys? What tactic really
too much to
resonated?
say. We had one for each letter, but given we have to pick two, maybe on the R, we talked about how, or would you like another letter?
Any letter. You
okay.
guys give us. You give us three, so Len. You guys have so many. Give us three.
Okay, sounds good. So for the D, one example of defining the gap was from the lead movement. Where it was first about identifying that only $10 million was going to anti-lead exposure work, and that was a huge gap compared to the health of the children. And then choosing that as a specific cause, but with incrementalism, that's a window of entry towards broader environmental health. For the R, defining standards. So, for instance, in the livelihood movement, this was a guide that was adopted on what does it require to work with poor communities, and only accepting to work with governments, local or national, who accept those conditions for the communities to be respected. And then on I, one example was actually using windows, but it doesn't need to be just budget windows. I think, for instance, from the One Earth movement, it could, One Earth Living, it was also windows in the life journey. So for instance, if you're trying to change towards healthier behaviors using parenting, when someone's pregnant and they're about to become a new parent, how do we target them at that moment with some new information?
Right on. Great examples. Thank you so much. Lonnie, I was kind of in and out of this table. What kind of resonated most in the discussion? Or
I've been delegated.
okay.
I think we talked a lot about, I mean, as lots here, like the rallying coalition, maybe with a like timing window as well. So like some of the things I think that resonated, there was a really good example of like timing in terms of pre-election timing. So like when political parties are writing their manifestos, when politicians want to be seen like adored by communities, handing out things, or have committed something like everyone will get food and healthcare. Like that's the moment where you like approach them and say, great, like let me help you write something that will actually make that happen. So that was a really thing that resonated. We talked about how does that apply in countries where you don't have elections, and where maybe it's more about like elite engagement and figuring out like who in the government you can get on your side, who has power, who still wants not to be elected, but they still want to be supported either by the very high up in government or by the country itself. And I think we talked a bit about like how do you rally a coalition when there is no coalition yet? Like there isn't something where you're like, oh, everybody agrees that this is a good thing, and like common denominators, and like how do you kind of make sure you don't broaden it too much, but like get people around who are like, okay, but we all agree on this even if we have slightly different models. I think that resonated a lot. And then we have a couple of other points that we'll come back to.
We'll come back to you.
And I guess
go ahead. Sorry, Lonnie.
One more thing I thought that was really great too when thinking about windows is how do you like institutionalize around those? Mm-hmm. So it's not just a political window and you have a champion now that's supporting you, but embedding that within their manifesto. And so now it's part of their policy agenda. And I think as well we talked about different windows because it may not be an election window depending on the structure of that political economy, but there may be developments in national development plans or strategies or guidelines. So I think the kind of common theme was understanding the political economy, understanding where those windows are, and then the next step is how do you institutionalize around that opportunity.
Right on, right on. I love the nuance and depth that we're bringing to each of these approaches. Julius Ignatius Tabika, what resonated?
Yeah, thank you. So for us, we focused on voice demand. And one of the things that really resonated was the surround sound. But thinking about surround sound, not just within your own echo chamber, but going beyond to what Flavia mentioned. So how do you bring on board unusual suspects? So an example from the child labor, child exploitation movement is, yes, you want to have the survivors on board, but also business associations and labor movements, and really create that broad, wide coalition and create the surround sound in that way. So that's what we focused on. And then one thing maybe on Rally Coalition, building the trust. Co-creation is something that came up, really making sure that everyone is bought in by being invested not just in the overarching goal, but also contributing to the collective action.
Awesome. Emily, take us home on this question.
Yeah, so we had really diverse group, so thank you. And so two things, I mean, they much more about two things. One was really around the importance of evidence and really thinking about how you're building this evidence and making sure that this is participatory research that include both community and government, so that then you build the buy-in and the voice, I think, from the beginning. So that's something that came up as, important. The other piece that we discussed was around visibility, but visibility with the right audience. So really defining your audience from the beginning and thinking about who are those stakeholders that you need to think about, not just the top, but really what is this network of stakeholders that you need to influence, and making sure that this is really clear, and it's not always the most visible, actually, that is going to drive the visibility. Mm-hmm. So really defining that really well from the beginning.
I love this. So we got a lot of great ideas here, but a lot of very specific actions. If something's stalling, I think we always say, at least in CHIC, are we making it easy enough to collaborate and impactful enough? And if you're having a sense that that's not the case, well, like maybe action is not oxygen, is oxygen. You have to take more action. Maybe it's a question that you're doing too much consulting, not enough co-creation. Maybe it's the sense that you're actually targeting the wrong people. You haven't developed a compelling enough gap, like the lead industry. So there's so many different potential steps already on this page. that feel like resonant to this room, which I think is really worth a lot. I want to move to this second one where you're like, yeah, that was a nice story, but it didn't work. How would you either nuance some of these actions, or are there any that you would just say, I recommend against, and here's why? I'm just going to open it up to any table. We go Selene, then we'll go to the table in front. I'm sorry.
Some of the issues that came up, and I'm sure it's going to sound familiar in the community health movement, but it actually came from others. Sometimes you'll have actors that try to exploit the framework. So in the example of the standards, it's the same words, but people give a different meaning to it, and they say that they adhere to it, but in fact, they are not adhering to it, right? And so this is where you need to paint more color of what does it mean deeply, and what is really expected to be part of this. And then another example is from the rights movement. We were talking about the fact that unfortunately funding is too short, like 5 years is not enough. And if you look at the rights, and let's say the people who are from the anti-rights, right, they have a 50-year timeline and unrestricted funding and huge budgets. And so, and against that, we're looking at 5-year grants for very narrow purposes, right? And so also looking at how can we create a crossroads, again, between women's movements, climate movements, pro-choice movements, et cetera, like, because the opponent is the same, but right now the funding is much too fragmented, and also build a different expectation on how quickly the results will come. So, yeah.
Right on.
So we, and I'm Katie, Ash asked me to take the mic. We talked about actually just the overall concept of Drive feeling a little more like it was being done to rather than co-created and done with, which felt the latter feeling very important if you want government to ultimately own something. Engineer was the word that really felt like, we're kind of coming back to done to versus, and then we also talked about extrinsic and intrinsic rewards for government partners to actually want to implement, the plan that maybe their minister says is a great idea, but everyone has a lot of work on their plate at their job. So those are things. So we came up with an alternative to Drive that felt more feminine, we thought, feminist, which is Flow. So find evidence of the gap and examples of success, lift up a coalition of the willing, open a path through co-creation with the coalition, and then walk the path and track adoption.
Yeah, claps. Love this. And I think this is so important. It's like how the packaging of that message has to feel right for the particular piece. And I think you actually hit upon something that we were talking a lot about at our table, which was grace, right? I think so often advocacy can feel very adversarial. You're wrong, shame on you, what a crappy job you're doing. And I think Lonnie was like, how about we approach people as humans? If any of us get that messages, we're on the defensive. And if it's more, wow, you're in a really hard job, this must be really bugging you. How do we solve it together? That's a different posture, and one that is likely to kind of emphasize more of the rewards and less of the risk of trying to move into a new future together. These are great risks to think about mitigation. The manipulation of the standard, I think, is really resonant. Co-creation, timeline. Some of us were at dinner last night. We heard the amazing story of how Backpage.com, which was a sex trafficking site, got taken off the internet by a group of police officers and priests and concerned citizens, and we heard the whole story, and it was incredible, and how they did it, and how they engaged journalists, and da-da-da-da-da. And then we were just about to move to another topic, and someone said, oh, how long did that take? And they said, 15 years. It's like, yeah, you don't get the Hollywood movie in a 24-month grant, probably. Maybe sometimes. But what is that pace of change, and how is that actually really rapid in the grand scheme of things? How do we reframe how we think about this? Do we have enough time to do it wrong over and over and over again, or one shot in our wild and precious lives to do it really right and make a really big difference? Any other things we want to add to the failed, refined, new acronyms? Yeah, Tabika, and then Emily.
Yeah, I guess it's already there, but in terms of defining standard, we also spoke about specificity. So Healthy Learners gave an example of you want to raise awareness, but that isn't really specific enough, and then you really need to define that with how do you move someone where you manage to raise the awareness to actually take an action that you want them to take. So be very clear and define that from the get-go, so you know exactly where you're moving in terms of your advocacy. So it's there already, it's kind of stating the obvious, but it's something that came up in our discussion.
Right on, right on. Emily?
One thing that came up also in our group was really around making sure that the KPIs that are defined matter for policy, makers, and not just for the movement. Because I think that if you really want to, move the dial, then you need to have this, everybody behind the same goal. So that's something that came up as well.
Right on. No, I think that's so often it's like, hey, we should do this, it's really exciting, and not, what's your problem or what's your KPI and how do we help you hit it? So I love that framing. Yes, back here, and then we'll go to Peter.
Hi, I'm John from Goodweave. Not a rhyme, not an acronym, but those are really important in advocacy.
Yes.
But I just want to mention something that at least you'll hear the ring to it. Attribution and contribution. Okay, in terms of measuring your advocacy, which is a patient and imperfect exercise, there's a default approach of attribution in terms of credit. The unit of analysis is often the organization or the social entrepreneur. Contribution then is it. So you can more easily attribute credit or blame or failure, right, to that unit. Contribution, right, is then the advocacy, the coalition, the movement, and then you can at best measure your contribution toward a wider whole. Very hard to disaggregate contributions in some cases, but that's when you've moved systems, and so it's an imperfect but really important distinction from sometimes how we're measuring our own impact as organizations.
Right. Are you telling the right story? For sure. I think that engineering and tracking adoption has to be the unit of analysis can't be in their organization, right? It has to be social, and that's a little more complicated, but it's possible, and there are good examples in this room of how to do that. Peter, do you have something on?
Yeah, we said that it's good to work with politicians because they drive resources, they drive policy, which are very important for sustainability, but we have to be careful that the issues are not politicized, because then that can lead to a disastrous outcome if the wrong parties join in and you're in a situation whereby you can't get out of it. Thanks.
Amazing.
And this may be moving over to the what to add at this point, but I think another conversation that we had was that, at least from my experience, oftentimes organizations focus on whether it's direct implementation or systems change with civil servants, or they focus on advocacy. And yet to really accomplish what we want to do, you need to do both. And yet those are two different skill sets, two different approaches, and even potentially two different cultures. And so as organizations, how do we make the decisions to invest in folks that have the understanding of the political economy, the networks, the kind of skills to be able to do that effectively? And how do we embed them within our culture of an organization successfully as well? Because what we're found is you actually get a lot of leverage when you help the government do things and you're bringing resources to the table, and you can leverage that to further advance your advocacy efforts as well. And so how do you create that harmony? And it really does create organizational investment, or require organizational investment.
Right on. Top down, bottom up, top down. How do we voicing demand comes in many different flavors. Let's make sure we're picking the right flavor and potentially multiple flavors simultaneously. Yeah, Emily.
I think similar could be also in what we add. I mean, something that came up is really thinking about how you design the pilot and how do you consider scale from the beginning and the system that where you're piloting, but more importantly, the affordability for the government. So really thinking about it from the beginning and kind of modeling it so that then we're not over-promising and then driving policy that might not be adequate for an impact at scale. So that's something that came up in our group, quite strongly.
What else would we add? We got Flavia, then Solen.
No, here there's something that came up that we said is like breadth versus depth. So it's about scaling and working in different territories or different countries, but that doesn't mean that your impact has necessarily grown. maybe like sometimes there were like some cases thinking maybe you're focusing on one country or one territory and maybe you have like bigger impact than scaling up like to different places. And this is something like to think about, in fact, when what does success or impact mean when scaling up?
Totally. I think a lot of times we think, for instance, when we've passed a policy like, oh, we won. And it's like, well, that policy could get reversed. You know, the defense is just as important as the offense, and the defense really comes more with depth, right, than a one-time campaign. And so what does success look like for the long term? That's to your point about measurement. These are really good questions, and often we can get suckered into some of the short-term big numbers, but they might not be durable. So then.
Yeah, so there were two quick frameworks we thought we would add. The first one is recognizing you need both pressure from the top and from the bottom. From the livelihood space, there's a triangle that they look at, which is a solution needs to be technically correct, administratively feasible for the government, and politically supported. And another one is you need to scale out, up, and deep. And deep sometimes is, I think, what we're talking about, where it's not just about a one-off policy win, but if you look at what has stuck and what hasn't, let's say marriage equality versus Roe versus Wade. The second one, the pro-choice movement, hasn't used enough that reframing of the issue in artists, in media, in education systems. They haven't won yet that scaling deep battle. And so maybe to make a small addition to the framework of Drive, you could add an R, which is the responsibilities, because in the coalition, you need to recognize that you need different types of actors. Some are going to be better at scaling out, others up, others deep, some for the pressure from the top, some from the pressure from the bottom. And so it could be an easy addition, just going from drive to driver, but also recognizing that you need, and that's why I think coalitions like CHIC, like CHU for UHC, et cetera, are quite powerful because different partners can bring different things.
Right on. We're heading towards the end of the session, guys, so we'll just take one from Julius, one here, and then we'll close it up on time. Oh, I'm so sorry. Can we 3 rapid-fire comments? Rapid fire, and then we'll close on time.
I think my comment was just around the rally, the coalition. So we spoke about the difference between advocacy, mobilizing, and organizing. And this is just from our experience. Sometimes mobilizing can feel like a means to an end, where people are not properly leading, or I guess your CHWs in this instance, leading, taking charge. It's their own agency, their own strategies, their own voice, etc. And so this kind of difference between not just mobilizing, but organizing and getting people to lead on the issues, themselves. Thank you.
Awesome. Julius? Oh, sorry. Maybe...
We talked a lot about our table at like the policy at the government level and rallying a coalition, but I think one addition I would make is that like you drive at different levels. I think that resonates a bit what you were saying, but like it might be a different strategy of like international financing and like getting like big donors to back you, to like governments to back you, to like other things. And I think that's something I would add in terms of like you might have different Ds and different Rs, but they need to speak to each other somehow.
Right on.
Yeah, the other thing that was mentioned on this table that I found interesting in terms of whether you are designed as a coalition from the get-go or retrofitting, and those requires different skills. And so, yeah.
Say one more sentence on that. What difference do you see?
Whether you're designed or you are
retrofit.
retrofitting.
Yeah.
If you're designed as coalition from the very outset, then these things are easy to fall into place. Whereas if you are retrofitting, people come with different motivations and different commitments, and at the end of the day, they are still separate organizations. And so it takes a lot more yeah.
Yeah, okay. So maybe additional tool sets around retrofitting we got to develop. All right, guys. Well, that's all we have for today. I want to say thank you. What we commit to do is we're going to get the recording of this. We're going to, try and harvest and organize as many of these ideas as possible. And if you want the full list of all the tactics, all the complications, all the things that we should add, the new and superior flow framework, then what you need to do is just shoot me an email at madeline.ballard@joinchic.org, subject line flow, And we will send it to you, and maybe we can continue that conversation. Maybe we can write something together. Maybe we can keep learning from each other and continue to trade tactics, ideas, and get stronger in each of our movements by learning from each other. So thanks so much for co-developing this today. Big round of applause.